12th February is celebrated as Sexual and Reproductive Health Awareness Day the world over. And this is a day when we bring sexual and reproductive health to the center stage. And this is especially important in a country like India, where there still happens to be a lot of hesitation and taboos in talking about matters of sexual and reproductive health, and especially women's reproductive health. But as we are understanding each day, it is increasingly important to talk about reproductive health right from puberty, so menstruation, pregnancy, PCOS, a positive pregnancy mindset when it does happen, and then post-pregnancy recovery. These are things that are increasingly and heavily important to talk about. And for young athletes, we would like to make the case that, while you do have a lot of counseling and support systems for managing nutrition or pain, we do not have that kind of a conversation around, issues of safe sex, pregnancy management, post-pregnancy recovery for athletes. And while more recently we have had athletes like Deepika Palikal and Sania Mirza who have set an example after becoming mothers, they have bounced back into their sport. Deepika became a mother of twins, and then she bounced back in the CWG, the Commonwealth Games in Birmingham last year. And Sania Mirza, of course, is a legend in her own right, and Sania has spoken to RevSportz extensively on prior occasions about how she put on a lot of weight and how she was body shamed during her pregnancy, and how she then came back. She stormed back, and she has only recently played her last Grand Slam, and she is due to play her last tournament in a few days. So Sania and Deepika, of course, are examples, but sadly they are a handful of women who do not imagine that as an athlete your life comes to an end. Your life in your sport comes to an end when you get pregnant. So we do need more conversation, more information, which is enabling for young athletes and women and men in general about sexual and health awareness. So as we celebrate sexual and reproductive health awareness today, please listen in to our special guests.
To tell that reproductive and sexual health actually doesn't mean that, usually we feel that it doesn't mean that it's a physical, mental or social well-being. It is the complete physical, mental and social well-being. Broad areas, broadly, if you say we have to concentrate on certain things in sexual health. One is family planning services, use of contraceptives, then spacing of birth, then prevention of sexually transmitted diseases. One area you should focus. Another is sexual health. Sexual health is you have to be respecting the partners. The partners should be respect each other, and it should be a positive approach. What is lacking in India is that you need proper adolescent sex education. So something like a taboo. Nobody wants to talk about sex. They get a lot of wrong information from friends as well as social media, which they search. Okay, social media, there are so many good information. They search so many wrong information. So you see, even to that extent, even next week, the Valentine's Day is coming. So even international, what they have done is that to increase awareness, they put International Condom Day on February 13th. So it increases, like these are some ways. I'm just telling an example. See, even if it is not the adolescence and reproductive, even if the maternal health also comes in this. So you should have a safe antenatal period, means during pregnancy they should be treated properly, delivery should be done properly, and postpartum, that is recovery, should be done. So all this comes together are the important components of what you usually say is a reproductive and sexual health. These are the components which are important in it.
Three most important things that come to my mind. One would be, there is definitely still, a need for further increase in institutional deliveries. There is still quite a number of patients or women who get delivered at home, and that inadvertently leads to certain, avoidable or could be managed better kind of complications, like the baby having fetal hypoxia, as in like decreased oxygen supply to the baby, or something like cord prolapse, where during the delivery the umbilical cord comes out and the baby is not out yet. So these things lead to either intrauterine fetal deaths or stillbirths. And from a maternal point of view, I think it can lead to a lot of post delivery bleeding. It's called postpartum hemorrhage. And sometimes the lady might require blood transfusions or life saving surgeries or ICU admissions, and those things don't happen when the mother is delivered at home. The other thing would be, there is definitely still an ongoing need, I would say, for contraceptive awareness.
Okay.
Because we need to increase the acceptance of contraceptives in the public's mind, because they end up being more scared of the contraceptives than of unwanted pregnancies.
The most important medical conditions which we see are endometriosis, then tuberculosis, patient on taking antidepressant drugs, or psychotic patients, patient of diabetes mellitus, obesity, or if she is suffering from Cushing syndrome, premature ovarian failure in case of pituitary tumor, microadenoma or prolactinema, and women taking alcohol and excessive smoking. That also affect the sexual health of the women. So for endometriosis, these days many drugs are available. We can treat her. Then antidepressant, we must consult the psychiatrist what antidepressant they should take. Then diabetes mellitus should be properly treated and controlled. Premature ovarian failure is very important, because in some cases of premature ovarian failure, we usually the problems is there, or ovulation does not occur. If there is any tumor, pituitary tumor, that can also lead to, that should be investigated and treated properly. We must ask the women to cut down the smoking, and they must reduce the alcohol if she is taking excessive alcohol.
People, especially in our part of the world, people don't really take sports people or famous people, so to say, as just for what they do. They become much larger than that. Some people have more responsibility, some people have less responsibility, but I do understand that I have a lot of responsibility on my shoulders. It's always been there. I've been answering questions to about all kinds of things since I was 16 years old, before I even understood what it meant. And I'm 35 today. So I completely understand that. And that's one of the reasons that I actually had made the comeback. Even if I've inspired one young mother to say that I want to follow my dream, regardless of the fact that I am married, or regardless of the fact that I had a child, and regardless how many people told me that I shouldn't or can't do it. And if she's gone and followed her dream, I'll consider my job done. And that was one of the reasons that I was putting out those videos, where I wanted to show the journey of, because I'm telling you, some of my best friends after I lost the weight won the tournament in Hobart and have messaged me and said, we really thought you're never going to play tennis the way you were looking. I've had that from some of my best friends. And I told them, I guess you guys don't know me well enough. These are people that have known me for 20 years. I mean, since school and college. I think for me, in our part of the world, many times women are always meant to sacrifice themselves. It's a thing, that a woman, she needs to sacrifice her career, she needs to sacrifice her time, she needs to sacrifice for her family. And if she doesn't sacrifice, then she's not good enough. Yeah, she's not good enough. And many people don't want to accept this, but this is the truth. Women face this on a day-to-day basis, when young girls say that, no, I want to go to work. And they say, yeah, but who's going to look after the house? Who's going to make the decision of who's going to cook the food at home if you have a cook, or who's going to cook the food? So that is something that I wanted to change a perception, because I understand the responsibility I have, and I feel that I have the reach to inspire. The amount of messages, Boria, I used to get, I cannot tell you, it was in thousands on Instagram when I used to post the video saying, I didn't want to go out for a walk today. I've just had a baby, but I saw your video and I've gone out to the gym. Those are the messages that I was doing it for.